Yeah, yeah, yeah. I don't know where Josiah is. Where's Brian? I don't know where Brian is. He told me to hang tight. Brian told me to hang tight, and I don't see Brian anymore. You guys can keep talking right now. I think I'm I'm waiting on Brian to tell me I can start. I don't. You sure? All right. Well, thank you all for being here. What I believe is the most well attended press conference thus far. Yeah, Counselor Bellis knows how to bring a crowd, apparently. Um, well, first of all, I am so excited. Today, I believe, is a big step forward for our community. And I think it's one step forward in tackling one of the greatest challenges our city has, which is the health of our people, something that is not always reflected here at City Hall and how we address it. Before I get started, this is going to be the most awkward thing I do this entire time I say that, is try to recognize a few people, maybe a few organizations in the crowd, which is going to be impossible. So if I forget or leave one out, know that Counselor Bellis wrote these things for me. No, I'm just kidding. But I think it's important that I recognize a few folks in the room, certainly from an organizational standpoint. We have some folks here from TU Health Sciences, from the OU School of Community Medicine, from OSU Health Sciences. I rode up with Johnny Stevens earlier. From Hillcrest, Ascension St. John, St. Francis. We have Community Health Connections here. I saw Bill Knight. There's Bill Knight with the Chamber. I believe we have some folks from Cherokee Nation who are also in the building. And, it's not a great room unless you have more than one mayor in it. And so we have Mayor Susan Savage here with Morton. Thank you, Mayor, for also being here. Obviously, we have our folks up here, but there's somebody that I do want to recognize, and all the wonderful other people. You all are MVPs to me. Just want to tell you that. But there is an individual that I do think this is very appropriate to recognize him in somewhat of a special way, and that's Bruce Dart. And the reason why I would like to recognize Bruce Dart, I know it maybe seems like a long time for some of us. I know it's a very trying time for all of us, particularly those of you in the medical field. But I think about if we were to rewind several years back to the depths of the pandemic. Well, we're not going to actually go back there. But I know that Bruce Dart was someone who was out front, someone because he was out front took a lot of heat from people he shouldn't have had to take heat from. It was a very thankless deal. But I think about someone who's woken up every day with community health being at the center of it, and whether it's good day or bad day, there's probably not a whole lot of credit that goes there and a fair amount of criticism. And I think, anytime that we are having a conversation about how we all come together around community health, I'm really glad to have you here, and I appreciate everything you've done for our city. You know. So when I started my career, I actually started my career in the mayor's office. I was hired by Kathy Taylor at the time to work in areas of juvenile delinquency, which spilled into work around education. And from there, I actually went and worked at the OU School of Community Medicine. Monica Pasu helped get me that job. Job was at a special time at OU when the School of Community Medicine was just getting launched, really thinking about how does a university, play a role in the life of the underlying issues and making sure folks were healthy. And when I left OU, I got into the economic development world, worked at the Chamber for a period of time for Career Tech before I went on to co-found Impact Tulsa. The reason why I bring any of that up is not to, have you all believe I can't hold down a job. But I remember being here in the mayor's office back in 2006 and looking at a heat map on where we had challenges as it related to juvenile delinquency and where we had challenges related to education. And if I were to take a map when I got to OU, we were looking at health disparities across our community. I lay them over the top of each other. They would almost to the street be the same map. And then when I got to the Chamber, we're looking at unemployment challenges we had across the community and economic inequality. The map looked the same. And I think that's always had an impact on me. And really goes to show that the real truth is that health outcomes aren't just a result of what happens inside of a doctor's office. Um, Well, that's really extremely important, and we obviously have some amazing health resources here in the city. We do believe that health outcomes are a community issue. And the thing that we're trying to solve right now, or at least begin to address in the most aggressive way we know how, is to really go after those social drivers that are really driving bad health outcomes in Tulsa. We know that the health of our community is impacted by neighborhoods that folks are living in, by jobs, by access to food that we may or may not have, by schools we attend, by transportation. All these things impact the way in which we live. And if we didn't believe that, if that wasn't part of what we thought in our gut, well, the good news is we don't have to worry about gut instincts on this deal. Everybody in here knows the stats that back it up. They tell us that 70% of a person's health is determined by these social drivers. And if we're going to make a real difference in this community, we have to go at them very directly. And so I'm happy to announce that we are launching Tulsa's first ever Office of Health and Well-Being, thanks to generous support and a donation from Community Care, Josiah's here, you'll hear from in a second, and a grant through the George Kaiser Family Foundation. This office will lay the roadmap to help us begin to reduce those disparities, continuing the work of so many in this community already. The one thing I want to make clear, I don't think that this work started the day I got elected mayor. This work has been long-term, and I want to say for everybody who's had a hand in it, I certainly appreciate it. Today's announcement is not that we think we're so smart and we thought about something people never thought about before, but it's saying we're going to get in the game with you. That's what today is about. And so I want everybody to know that we not only respect what you all have done over the last number of years, we think it's the most important work ever, and the city wants to be a part of it. So this office will first look internally. We know we got some work to do here to get in the game, as I said, and work to across city departments to connect the dots between housing, public safety, education, and health, using our neighborhood conditions index to help gauge these social determinants impacting our community across the city, and help design that roadmap for success. This office will also be in charge of creating a Mayor's Health Coalition, bringing together health leaders from across our community and making sure that we're identifying the challenges that residents have, and again, making sure we're all doing this work together in an aligned way. It will also oversee critical initiatives like the $4 million Children's Mental Health Initiative, ensuring we're investing in mental health and well-being of our youth. This office is about making sure we build a city where health isn't determined by zip code, income, or background. It's the same way we think about education and everything else. We don't think it should be determined by your parents' income. We don't think it should be determined just by where you live. We think that no matter where you are in this community, you ought to have access to high-quality education. You ought to be able to live a healthy lifestyle, making sure this is the best place in the country to live, to play, to learn, and to raise a family. It's about creating a city where every child has a fair start, every family has a fair shot, and every neighbor has a chance to live a long and healthy life. So Dr. Pasha, who's been an incredible advocate for the health work in Tulsa prior to his time at City Hall, I always say it took it a little personal when we announced Jabron was coming into the mayor's office, because I got to tell you, I was happy when people were like, oh my goodness, I'm so glad that you're the mayor, and I would get that a lot. And then we announced that Jabron was coming here, and I'd see people and their faces would light up, and I was like, oh, here we go. Give me all the love because you're so happy that I'm mayor. And they're like, Jabron. And I'm like, oh, yes, Jabron also works in the mayor's office now. But he has been such an instrumental part in making all this happen. Interestingly enough, I've known Jabron a number of years and have been a big fan of his for those years. And after I got elected, he tells a story. Maybe he's going to tell a story, but it's okay. He's not going to tell it. But I didn't know this, but Jabron was waiting for the appropriate time to come talk to me about doing this kind of stuff here at the city. And I instead reached out to him before he ever reached out to me. And I asked him, what would it look like for us to create a space at City Hall dedicated to thinking about health outcomes, dedicated to tackling these social determinants of health, dedicated to working with partners across this community. We know we have excellent medical education in this community. We know we have excellent institutions where you can get care. We know we have obviously having an insurance company be a partner in this, people who are willing to jump and do things. Um, but but how do we create? How do we help facilitate that at the city? I didn't know how to do it. He did know how to do it, and so I'm really happy to welcome to the podium someone who has been just a tireless advocate for this work for a very, very long time. He and I are going to get into it this football season. He's a Chiefs fan, which is fine, I guess. Everybody is now, but everybody knows America's no the Eagles. No. Everybody knows who America's team is, and I thought before he comes up here, I want to welcome to the podium someone who should be a Dallas Cowboys fan, but he doesn't have that kind of class all day long. But he does know a lot about health, and that is my good friend, our senior advisor for community health, Jabron Pasha.
I had a great story to open this thing up, and now I have to figure out a new story to tell you all. I want to just take a moment to thank Mayor Nichols for his leadership. In January, we sat down and kind of gave this idea legs. And I want to just acknowledge that you have done everything that you told me you would do to make this happen from day one. And with all the things that a mayor has to juggle, that tells me this is as much a priority for you as it is for me. And so I really sincerely thank you for the support. You know, when we had that conversation, it became really clear to me that we both felt like the city should take a more active role in the health of a community. And so, are we on? It's not me, the mic's not on. Okay, all right, good. We'll speak up. All right.
Media who we love and value. Not just for me, we love you.
And we think about the city. It's unfortunate, but we do have some poor health outcomes, and we've got to be upfront with ourselves, right? That's our challenge. We know that our infant mortality is 20% higher than the national average. We are more likely as Tulsans, 70% more likely as Tulsans to die from heart disease than the rest of the country. We're 20% more likely to die from stroke. And comparing ourselves to the rest of Oklahoma, Tulsans are 35% more likely to die from diabetes. Right? So we've got a lot of work to do, right? And part of that starts with just raising awareness. And we want to really uplift these statistics not as a dark cloud over Tulsa, but opportunity. And it literally is going to take everybody in this room to get us there. We're going to spend a good amount of time interfacing with the community, letting them know that we are a trusted entity that cares about their health. The city should and can play a role in making the community more healthy. We're going to have citywide initiatives to screen for these chronic diseases, and we can't do that by ourselves, right? We are going to quarterback that, right? We're going to facilitate that. It is you all who have done this work that we want to continue to bring together in fashions very similar to this. They did not think we could get this group together. They even tried to get us to get a little extra security. When you got OU and OSU in the same room, you got, Ascension and St. Francis in the same room. Knowing that you all are market competitors, but there are things that we can do together. And I'm really proud to see everyone who has an impact on the health of this community here in this same room. In terms of cancer, we have a lot of opportunity as well. We are, as Tulsans, 15% more likely to die from cancer. And I think there's low-hanging fruit there because early detection is a really important way to lower those mortality rates, right? And so I've already been in conversation with Cherokee Nation and other entities about some citywide screening initiatives for lung cancer, colon cancer, breast cancer, prostate cancer. I think those are some things that we can get out of the gate and make rather immediate impacts, and so we're excited about that. But we have to recognize that in order for us to get the outcomes that we deserve as a city, we have to create neighborhoods that foster health and well-being. As the mayor pointed out, an individual is more impacted by the neighborhood that they live in than the health care that they receive from their doctors. Right? And so we have to actively create neighborhoods that allow for healthy living, that have fresh and healthy foods, that have green spaces, they're free of loose animals, there's street lights and sidewalks, there's economic opportunity, there's education opportunity. That is the only way that we can create the health that we need in this city. And we have to do it together, and it has to start within these walls. Right? I'm really excited to work with my colleagues in housing and homelessness, the Office of Children, Youth, and Families, and the Children's Cabinet, the Office of Resilience and Equity. We all can work together to achieve these goals. Public safety as well. We've got several members from Tulsa Fire Department in this room and EMS in this room. I look forward to working together with you all because you all are doing it every day, and you're making an impact, and we want to just find ways to support you all. The planning office. We have become really, really close friends. I don't know where they are in this room. Let me take a moment to talk about the tool that the planning office has created. It's called the Neighborhood Conditions Index. And if I've talked to you in the last month, I have talked to you about this tool. It is a tool that allows us to look at social drivers at a neighborhood level. No other city has a tool like this. And I want to help build in health outcomes into this tool with the help of Susan and Paulina and Kia, who are remarkable partners. Data is going to get us there, right? Some of the data we've already mentioned. Data has to inform the initiatives, but data is just data if we just fall in love with the problem. We can't just go around spouting statistics if we're not willing to do the work, right? And data tells a very important story. Data tells the people's story. And sometimes we lose sight of that, right? Data is telling the story of Tulsans whose lives are cut short, right? Who don't get to see their grandkids go to high school, right? There's a lot of lost opportunity, and we have to understand that data is just a tool that really gets us back to the community. I think we can all agree that we're in a mental health crisis in this city. Right? We know that Tulsans are 70% more likely to die from suicide than the rest of the country. And that's primarily because 1 in 3 Tulsans will have some sort of depressive episode in their lifetime. Right? Mental health touches so many sectors, right? It touches public safety, it touches criminal justice system, it touches education. And we want, with this office, really want to quarterback and really help convene these organizations to address these issues. And one of the first ways we're doing that is with the Children's Mental Health Grant. Amy McGeehee's in the back in blue. She is doing a great job bringing partners together to address the mental health issues that our children are facing here in Tulsa. There's so many people here and so many organizations that I just value and am so thankful for. We're going to need to lean on all of you all. First and foremost, the Tulsa Health Department. Fortunate to have an incredible relationship with Dr. Dart. We've known each other and worked together for many years, and they are the public health entity of this city. That does not change. But we have to find ways to see how we can be supportive of them and work together. We've already began that work, right? And Dr. Dart, as the mayor mentioned, we're thankful for your leadership, thankful for your partnership. We're glad you're here today. Our health systems, we can't do it without you. Our St. Francis, our Hillcrest, our Ascension St. John, all represented here today. You power healthcare in this community. And in order for us to make the strides, we have to find ways to work together. And I'm hopeful that we can do that. I've had conversations with all of you about this work and have felt nothing but support. So we're excited to continue those conversations. Our academic institutions in TU and OU and OSU, you train the health workforce, which is critical. What you bring in terms of research and clinical care, is equally impactful. So thankful for you all. Our federally qualified health centers in Morton and Community Health Connections play a major role in this work as well, and we're thankful for your work. We're going to focus a lot on mental health, and we have 4 amazing certified mental health organizations in Grand and Family and Children's Services, Counseling and Recovery Services, and CREOKS. And it is a priority for us to help our colleagues at the state capitol understand your value here to our city. I think we can do that while also finding ways to work better together and more efficiently. So we're looking forward to that. I want to make sure that I haven't forgotten anyone because you all are important.
Already in trouble.
I know, right?
Hey,
My wife and my parents are here too, and that's great. You know, I didn't want to make this about me, but it's my wife and my parents. So I got my father-in-law and
everybody out. I'm like,
yeah, fair, yeah. And my father-in-law as well. The tribes, Cherokee Nation has been a great partner already, and we continue to figure out ways to improve the health of the community here. For our community organizations that are scattered across this room, to me, you're the heart of this work, and you will continue to be the heart of this work because you are closest to the community, right? You're closest to the community voice, and we've got Growing Together, we got Terrence Crutcher Foundation, Northside Neighbors, Oklahoma Birth Equity Initiative, who has the best name in Tulsa, OK Bay, Amplify, Take Control Initiative, Tulsa Cares, you all are and others, you all are making an important, going to be an important part of this, and I'm so thankful for your partnership going forward. For our insurers, we'll get to community care, but we are already establishing really good partnerships. Oklahoma Complete Health is in this office once a week. They were here yesterday, and they are in Oklahoma City, and they drove back. We're doing some amazing work in North Tulsa with Oklahoma Complete Health and Reggie Ivy with Northside Neighbors. We've had conversations with Aetna. We're having conversations with Humana, Dr. Dennis soon. But to sit down with Josiah just a few weeks ago in our office and to just try to get him to understand, hey, this is our vision. It didn't take much. We spent some time with the Neighborhood Conditions Index, of course. We talked about what we wanted to build. And Josiah said, I get it. Right? And we're going to support you. And so to have community care as our really first big partner in this work says a lot for Josiah, but also community care as an organization. And we can't thank them enough. And with that, I'm going to bring up Counselor Bellis, who I'm really happy is supportive of this work, primarily because we have daughters in the same class, and pickup would have been really awkward if that wasn't the case. So, thank you.
I have to thank Dr. Pasha for reassuring my toddler that her legs still worked the other day. So thank you. And as a very sleep deprived person on parental leave right now who has a lot of medical anxiety, this is the best room I've ever been in. Don't give me your phone number. I will text you anxious medical questions in the middle of the night. I will. Yeah. No, I am so excited to be here. To speak to this today. It's like an amazing family reunion. I have worked with so many of you for the past decade leading the Take Control initiative, and to get to stand here to look at coordinated healthcare partnership from a city perspective is huge, and to me in a lot of ways is a dream come true. When I first started at the Take Control initiative and I would talk to funders and try to fundraise, and I would be talking to them about women's health. We're a women's health organization, and they would go, oh, we do focus on economic outcomes. We're not doing that kind of women's health stuff. And that was the most frustrating thing I'd ever heard. And then a few years later, when I first ran for office in 2022, and I was meeting with some business community partners, they asked me what my priorities were, and I started talking about public health and community health and the social determinants of health. And I got met with, well, that's not the city's business. Cities do streets and sewers and stuff like that. That's not what the city does. And I found that to be so frustrating because in the charter, it actually says that we are required to, like, our job as people who are making policies and ordinances is to protect the health and well-being of the city of Tulsa, of community members. And I understand, of course, we have the health department and there's so many other entities that are responsible for health, but to pretend that all of the things we do here in City Hall don't tie in or shouldn't be striving to support our healthcare infrastructure and the health of Tulsans, that's just an insult to everyone's intelligence. We know it's all interrelated. The reason we have zoning is to make sure that we're not having, heavy industrial toxins right next to neighborhoods, right? That's a core function of the city, zoning and city planning, right? Neighborhoods and planning and urban design, that's a health issue. We have coordinated emergency response, making sure that people get the right care at the right time, whether it's our fire department, police department, EMSA, that is a public safety issue and it's a health issue. And I used to be a teacher. I had so many students who missed so much school, whether it was taking care of a sick parent or taking care of themselves or just not being able to get a ride because the person who took care of them was sick. And they would miss so much school, and that would affect their educational attainment and outcomes, because health is also an education issue, and it's a transportation issue, and it's so much more that touches people's lives every single day, just as much as the city does. I know we're supposed to focus on streets and sewers, but we now know from having a pandemic that we can learn a lot about our health and well-being from testing what's in the sewers. I'm just saying that's important. We know that we need to pay attention to how healthy our water is, what kind of chemicals might be there, which I've been reassured by our water department. We have stellar water, just so you all know. I always ask. But all of that ties in. And when we've spent time potentially thinking that these things are separate or that's not our lane, we've missed opportunities that today we get to forcefully say, hey, we're going to capitalize on those. We're going to coordinate. We're going to collaborate. We're going to be a convening hub because so many of you are doing this critical work every day. And it's beautiful to see clinics and community partners and universities and insurers and all of us in one room. Again, if anyone has a medical emergency right now, you couldn't be in a better place. I'm so, it's just such a wonderful space to be with all of you here. Health is a city issue. It's inextricably bound to economic outcomes as well. People's lives are sometimes hinging, right, on medical bills. The majority of Tulsans are one medical bill away from poverty. That's true for most Americans. And the healthcare industry is one of the fastest growing in the nation. And we're a medical hub for the region. This is also an economic issue. It touches every single part of all of our lives. And I'm so deeply grateful that we are, as a city, formally joining you all in this work in such a meaningful way. It's an incredible honor to get to embark on this alongside so many dedicated people. And I'm very, very grateful to Community Care that they're helping us kick this off together. So I'm going to pass it over to Josiah Sutton now with Community Care. Thank you.
Well, it's great to be here with you today. Whenever Dr. Pasha and the mayor reached out, if you've ever spent time with either one of them separately, it's quite invigorating and exciting. And then you get both of them in the same room together. And Jabron is right. It didn't take long for Community Care to want to be a part of this. But there were two things that really stood out to me, and they've been touched on today. One, if you typically look at population health programs or care management programs, all of them start at a zip code level or a county level or some roll up to something in an area that makes it difficult to really start to address whatever the core need is. And to have the breakdown at a neighborhood level with data with individuals in those communities being impacted is something I had never seen before. And so as Dr. Pasha was walking through the different dashboards and analysis, I thought, oh my gosh, this is something like Community Care could use to develop and continue to develop our diabetes management programs and hypertension programs and focus on obesity. But then the second thing that really stood out was the focus on developing tools and resources and then giving them back to community leaders within those neighborhoods and allowing them to take ownership of whatever the need is in their neighborhood and their community, and then have the power of the city and the resources of the city behind them. So with those two things, it really was a no-brainer for Community Care to partner with the city in this incredible work. So I thank you for your leadership and vision in this. And while Community Care was the first to contribute financially, I just want everybody to rest assured this is far greater than a financial investment. We were making resource investments through our employees. We have over 500 employees working right down the street. Many of them are waiting for the call to be able to volunteer in this work and contribute. So thank you all for the opportunity.
Thank you. Thank you. Last couple things I'll say, and I think we're going to take maybe some questions up, just a couple questions up here. You heard from the folks up here. I talked about Dr. Pasha. I'll also say just a quick word about Counselor Bellis. I know there's several counselors who know how critically important this stuff is. There are few of them who are actually involved in this kind of work outside of their official role here at City Hall. And so it's not an accident that somebody who has been in the fight with you all every day is up here talking about this. Again, it goes to show that while we know it's important, it's a focus of the mayor's office. Even within this building, we recognize it's not new to being a priority and really the driver for a lot of folks who are here at City Hall. You heard Jabron talk about the planning department. Obviously, Counselor Bellis and her work up here. I wanted to also recognize, I didn't see her at first, but the Deputy Mayor, Crystal Reyes, is here. Crystal, thank you for being in here today. Who is also on the board of the health department, as it turns out. Everybody gets invited to stuff but me. That's crazy. Oh, interesting. But certainly appreciate the partnership with Counselor Bellis and really the leadership over time in this area. And Josiah was absolutely amazing when he came. It's kind of one of those things when you're talking about an issue and you don't know if somebody's going to care about it or not, but it's almost like you can finish each other's sentences in some ways. And so what struck me about that is the alignment that we all have and what we know is a real problem and a big problem. And the thing that I'm struck by right now is that we have this big, massive problem. I look around this room, and I think it got a whole lot smaller because of all of us working together. So I look forward to doing that over the next many days, months, years, however long it takes. We're all in the people business, and it's going to be tough. But I can tell you, there's not a group of people anywhere in the country I'd be rather doing this work with, so I appreciate you all. Got any questions for us, Jabron, Counselor Bellis? Josiah's going to answer them. I'm going to dodge them. Here we go. What you got?
Any media questions?
Awesome. No, just kidding.
If there aren't, we'll have everybody available here, and thanks everyone for coming.
Cool. Thank you all for being here.
Okay. Just then.